Ever wondered why you reach for certain medications in specific situations? Welcome to the fascinating world of medications, where every bottle, pill, or syrup has a specific purpose, a unique story, and a targeted effect on our bodies. This vast world isn't just a collection of chemical compounds, but rather a testament to human ingenuity and our endless quest for health and longevity. Our journey today will take us through the intricate labyrinth of 4 types of commonly used medications: hypnotics, laxatives, analgesics, and antipyretics. Each of these medications plays a pivotal role in our daily lives, helping us manage everything from sleep disorders to pain and fever. First, let's talk about hypnotics. These are the sleep inducers, the guardians of our nighttime tranquility. They work by calming the mind, slowing down our thoughts, and nudging us gently into the world of dreams. But like all medications, they must be used responsibly, or else they could turn from a bedtime friend into a nighttime foe. Next, we have laxatives, the facilitators of digestive harmony. They help keep things moving, ensuring our digestive system runs smoothly. They offer relief when the going gets tough, but remember, they're not a long-term solution to chronic digestive issues. Moving on to analgesics, our trusted allies in the battle against pain. From headaches to muscle aches, analgesics are there to bring us relief. They work by blocking the pain signals to our brain, allowing us to carry on with our daily activities. But remember, they treat the symptom, not the cause. Finally, we'll explore antipyretics, the fever fighters. They help our bodies maintain a normal temperature when illness causes it to spike. They are our first line of defense against fever, but they don't fight the underlying infection causing the fever. Each of these medications, when used correctly, can greatly enhance our quality of life. But misuse can lead to serious health problems. This is why understanding them is so crucial. Stay tuned to learn about the function and usage of these common calls in the medical world. First up, we have hypnotics, medications that are quite literally the stuff of dreams. Hypnotics, also known as soporific drugs, are a class of medications designed to induce sleep. They work by acting on the central nervous system, slowing brain activity to allow the onset of sleep. They are the night owls of the pharmaceutical world, swooping in when sleep seems elusive. A few common examples of these sleep-inducing agents include zolpidem, ezopiclone, and temazepam. These names may sound like characters from a science fiction novel, but they are very real and have a significant role in the world of sleep medicine. Now, let's take a closer look at how these medications work. You can think of them as the key masters of your brain. They interact with a specific neurotransmitter in your brain called GABA, which acts like a brake for brain activity. When hypnotics enter the scene, they boost the effects of GABA, leading to a decrease in brain activity. And voila, the Sandman comes calling. But like all medications, hypnotics are not without their side effects. These can range from mild ones like drowsiness and dizziness, to more serious issues like memory problems, sleep behaviors, and even dependency. That's why it's crucial to use these medications under the supervision of a healthcare provider. Hypnotics shine brightest when they're used to manage sleep disorders. Conditions like insomnia, where people struggle to fall asleep or stay asleep, can be debilitating. It's like being stuck in a never-ending cycle of wakefulness, with the promise of sleep just out of reach. That's where hypnotics come in. They can help break this cycle, providing much-needed relief for those wrestling with the shadowy world of sleep disorders. However, it's important to remember that these medications are not a long-term solution. They're more like a temporary lifeline, providing immediate relief while the underlying issues causing the sleep disorder are addressed. And let's not forget about the role of good sleep hygiene. Things like maintaining a consistent sleep schedule, ensuring a quiet and dark sleep environment, and avoiding caffeine and electronics before bed can greatly improve sleep quality. Hypnotics can then step in when these measures are not enough. But, as with all medications, it's a balancing act. Hypnotics need to be used judiciously, weighing the benefits against the potential risks. It's about finding that sweet spot where they provide the maximum benefit with the least amount of side effects. So, the next time you're up late at night staring at the ceiling, remember that there are tools available to help you. Hypnotics, with their sleep-inducing powers, can be a lifeline in the dark. Remember, while hypnotics can be a dream come true for those struggling with sleep, they must be used responsibly. Next, we have laxatives, the smooth operators of the medical world. Laxatives, as their name implies, work to relax, or more specifically stimulate, certain parts of the body to facilitate a smoother digestive process. Now you might be wondering, what exactly are laxatives and why are they so important in the grand scheme of our body's functioning? Well, let's break it down. Laxatives are substances that loosen stools and increase bowel movements. They come in many forms, from pills and capsules to liquids and powders, and even suppositories. Their primary function? To help alleviate constipation, a common ailment that can cause discomfort and distress. But how do these smooth operators work their magic? Laxatives primarily work in one of three ways. Some increase the bulk of your stool, which helps it move through your intestines. Others soften your stool, making it easier to pass. And some stimulate the muscles of your bowel, speeding up its transit. Now let's take a quick tour through the world of laxatives with a few examples. Bulk-forming laxatives like psyllium and methylcellulose work by absorbing water to form a soft, bulky stool. Stool softeners such as docusate sodium draw water from your intestines into your stool. Stimulant laxatives like bisacodyl and senna stimulate the muscles in your intestines to contract. While laxatives play a crucial role in managing constipation, they're not without their potential side effects. Overuse can lead to a variety of issues such as dehydration, electrolyte imbalance, and in some cases, dependency. Yes, that's right, your body can become accustomed to the laxative, making it harder for you to have a bowel movement without it. That's why it's essential to use laxatives responsibly, under the guidance of a healthcare provider. But it's not all doom and gloom. When used correctly, laxatives can provide significant relief for individuals struggling with constipation, making their day-to-day life much more comfortable. They can help restore regularity, alleviate abdominal discomfort, and in some cases, even support weight loss. So, in the world of medications, laxatives stand out as smooth operators, easing the path of digestion and relieving discomfort. They serve a crucial role in our body's intricate system, a testament to the wonders of medical science. But remember, as with all medications, it's all about balance. While laxatives can help you in the short term, it's also essential to consider long-term solutions like dietary changes and regular exercise, and there you have it. A brief yet insightful dive into the world of laxatives. While laxatives can be a relief during tough times, remember, too much of a good thing can cause problems. Moving on, let's explore analgesics, our trusted allies against pain. Imagine stubbing your toe or getting a paper cut. Your brain instantly recognizes the discomfort and sends out a red alert, resulting in what we all know as pain. Analgesics, also known as painkillers, are a class of drugs that help us combat this sensation, whether it's a mild annoyance or a severe, debilitating ache. Analgesics work by interacting with our body's pain signaling pathways. In simplistic terms, when we experience an injury, our body sends out chemicals called prostaglandins. These substances make our nerve endings more sensitive, amplifying the pain signals they send to the brain. Analgesics intervene in this process, inhibiting the production of prostaglandins, thereby reducing the pain we feel. To better understand this, let's consider a few examples. Over-the-counter analgesics like ibuprofen and aspirin are known as non-steroidal anti-inflammatory drugs, or NSAIDs. They work by blocking the enzymes that produce prostaglandins. On the other hand, we have opioid analgesics like morphine and codeine, which are much stronger painkillers. They work by binding to opioid receptors in the brain, altering our perception of pain. Analgesics are like superheroes, swooping in to save the day when we're in pain. But just like superheroes, they have their strengths and weaknesses. They are widely used to manage both acute and chronic pain, from a sprained ankle to the persistent discomfort of arthritis. They can also be used to relieve pain after surgery, or to manage the symptoms of diseases like cancer. However, while they are incredibly useful, analgesics are not without their side effects. NSAIDs, for instance, can cause stomach ulcers and increase the risk of heart problems when used extensively. Opioid analgesics, on the other hand, are infamous for their potential to cause addiction, and their misuse has led to a significant public health crisis in several parts of the world. It's important to remember that pain is a complex phenomenon, and managing it effectively often requires a multifaceted approach. Analgesics are a crucial tool in our arsenal against pain, but they aren't the only solution. Physical therapy, relaxation techniques, and lifestyle changes are all important aspects of pain management. In the end, it's all about balance. Using analgesics to manage pain can greatly enhance quality of life, but it's also crucial to be aware of the potential risks and side effects. Always consult with a healthcare professional before starting any new medication, and remember, just because a drug is available over the counter doesn't mean it's entirely safe or suitable for everyone. Analgesics, when used correctly, can be a lifeline for those in pain, but misuse can lead to serious complications. Finally, we have antipyretics, the fever fighters of the medication world. Like the underdog in a boxing match, these little warriors pack a punch when it comes to battling fever and its accompanying discomfort. Antipyretics, from the Greek words anti, meaning against, and pyretos, meaning fire, are medications used to reduce fever. They don't play around. When the body's thermostat, also known as the hypothalamus, gets a little overzealous, antipyretics step in to cool things down. But how does this happen, you might wonder? Well, these medications essentially block the production of prostaglandins, the chemicals that tell the hypothalamus to crank up the heat. By doing this, antipyretics restore the body's temperature to a more comfortable level. Common examples of antipyretics include acetaminophen, also known as paracetamol, and non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen. These are the everyday heroes you find in your medicine cabinet, always ready to step up when fever strikes. But, like any medication, antipyretics come with their own set of considerations. They're generally safe for short-term use, but long-term use or high doses can lead to side effects. For acetaminophen, these can include liver damage, while NSAIDs may cause stomach problems or increase the risk of heart conditions. Always consult with a healthcare professional before starting any new medication. Despite these potential side effects, the role of antipyretics in managing fever and discomfort cannot be overstated. When the body is under siege from a fever, these medications offer relief, helping the individual feel more comfortable. But it's important to note that while they reduce fever, they don't treat the underlying cause of the fever. They're the firefighters, if you will, putting out the flames but not fixing the faulty wiring. So next time you reach for that bottle of acetaminophen or ibuprofen, spare a thought for these fever fighters, doing their bit to keep your body's thermostat in check. Antipyretics are crucial in fighting fevers, but remember, they treat the symptom, not the cause. We've traveled through the world of hypnotics, laxatives, analgesics, and antipyretics today. Let's take a moment to reflect on the journey we've been on. We started with hypnotics, those sleep-inducing agents that can transport us to the world of dreams. We learned how they work, interacting with our nervous system to encourage sleep, but we also discussed their potential for misuse and the importance of using them responsibly, under the guidance of a healthcare professional. Next, we slid into the realm of laxatives, the smooth operators of the medication world. Their role, as we discovered, is to facilitate bowel movements, easing discomfort and treating conditions like constipation. We also emphasized the importance of not relying on them for prolonged periods without medical advice, as this can lead to dependency. Our journey then took us to the realm of analgesics, our allies in the fight against pain. From headaches to post-operative discomfort, these medications can provide significant relief. Yet we also recognize the potential for misuse, particularly with opioid-based analgesics, and the necessity for careful guided usage. Finally, we explored the world of antipyretics, our fever-fighting friends. They play a crucial role in managing fever, one of our body's responses to infection. But like our other medication groups, they too need to be used responsibly. Overuse can mask symptoms of a more serious condition, so it's vital to seek medical advice if a fever persists. Each of these medications plays a unique and important role in healthcare. Their potential benefits are vast, but they must always be used with awareness and respect for their power. Misuse can lead to complications, highlighting the importance of education about these substances. Remember, understanding our medications is the first step to using them effectively and responsibly. Until next time, stay curious and keep learning.